And then we have a hodgepodge of other type of insects. There's besides the spiders, there's centipedes, there are ticks, there are fleas, bed bugs, wasps, hornets, and bees, and the like. So here's just a slide of a tick. Um, Usually these guys bite in. They carry certain infectious products that cause the illness, and so the tick itself is not necessarily an issue. It's what the tick has in its bite that may cause things like Lyme disease, or Rocky Mountain scarlet fever. So anyhow, the removal of these things, the bees, the wasps, centipedes, and these kind of ticks, if we try to remove them, sometimes they just embed their stingers, fangs into the tissue, and so we're gonna try to we try to remove it by scraping the object out. And in some cases, these guys might lay. There might even be flies that lay eggs into tissue, and there are different ways of removal. So again, what we're trying not to do is remove this insects and having them leave the stinger or the fangs left in them. We try to scrape them out, and then more importantly, with the bee stings and wasp stings, then we're looking at when the stinger is left, or if it hasn't been left, as we remove it, we definitely don't want to pinch the back end of the stinger part, but more use like a credit card and to scrape this off. To go back to any of these bites and stings, again, the snakes usually neurotoxin, neurological symptoms. We end up having also some cardiovascular and respiratory collapse. Our spiders, they'll branch off into the black widow and brown recluse. The black widows are more neurotoxin, similar to the snakes, and then our brown recluse is more of our necrotizing, or it just starts to just cause the decay of tissue around the bite site or the injection site. And then we dealing with these smaller insects. They may leave back products that cause illness, or look for other symptoms for allergic reaction, and that would be our urticaria or hives, and then the large redness or erythema, and then any type of itching and pruritus. Remember that with allergic reaction, we can also have respiratory compromise. We also have cardiovascular compromise, or blood pressure goes down, and then it may affect a few other systems such as the skin or the GI tract.